The Mesa Chamber of Commerce Inside Business podcast brings you a unique view of Mesa through its vibrant business community and the subjects that are important. The podcast is produced in the Mesa Chamber of Commerce Media Studio, sponsored by the University of Phoenix. Our podcast is hosted by Mesa Chamber of Commerce CEO Sally Harrison. Please enjoy this episode of the Mesa Chamber Inside Business podcast.
Hello, everybody, and welcome to the Mesa Chamber Inside Business Podcast. I am your host, Bob Nelson, and we are here today to spend some quality time with Dr. Kaleigh Robinson of Eve Pet Hospital. Welcome.
Hi, Bob. I'm glad to be here.
It is fantastic to have you. So we are going to talk about you, right?
And Eve Pet Hospital.
And Eve Pet Hospital, and we're going to talk about all kinds of fun stuff. So before we get started, I just wanted to thank you guys. You guys were the sponsor of our most recent Mesa Morning Live Top 10 segment, which I think might be uploaded now. So people can kind of get a sort of a visual of you to kind of go with this podcast, right?
Yes, in all my colorful glory.
Yes, fantastic. Okay. So let's kick this off. Let's talk a little bit about you. Let's talk about your background. Let's talk about kind of your journey up to you getting to Eve.
So I was one of those kids that knew what I wanted to do when I was 9 years old. I told my mom I was going to be a vet.
Oh,
so
that's fantastic.
The plan never really changed. I did feel that I was going to go in one direction or the other, but it always landed on being a veterinarian. So I worked hard through high school, and I joined things like FFA, Futures Farmers of America, and did volunteer work at a local veterinary office. And then I got my animal science degree from UC Davis.
Okay.
And I worked with a few animal rescues at that point as well. I did some wildlife research with birds of prey and some water birds with International Bird Rescue.
Oh, nice.
And then...
What was your favorite bird? I'm going to ask you. What was your...
Oh, the barn owl Buddy.
Really?
Yes, he was our education bird.
Okay.
And so he and I, because he was the education bird, he had to be trained to the glove. And so part of my job was to just sit with Buddy on my arm for 2 hours a day.
And it's like... Okay, so we're going to talk about Buddy for a second because owls are cool, right? Right?
Yeah, exactly.
So like you're sitting there, you got Buddy on a glove, right? He's sitting right here. Does he like every once in a while just kind of look at you like, hey, what's going on? And then kind of look away.
Yeah, he was definitely, would be interested in things going on around him. But if there was nothing going on, there's no other people around, he would kind of look at me and be like, what's up?
Okay, sorry, keep going.
So after I graduated from UC Davis, I got into Kansas State for veterinary school.
Okay.
So I ended up moving to the Midwest and deciding that I never wanted to live where it snowed again.
Yeah. Yeah, I lived in Nebraska, so I totally empathize with that.
Yeah. So when I was graduating from vet school, I was still looking into what direction or department I wanted to be in. So I ended up kind of looking for an internship. So just like doctors, we have internships and residencies, like medical doctors, veterinarians do that too. So I did a internship at a big multi-department corporate hospital where I got to work in all sorts of departments, from emergency to the internal medicine program to the surgeries, and even a few weeks in general practice.
Okay.
So that's where I learned that what I most liked doing was emergency medicine.
Okay.
I like to fix it.
Right. Find the error and fix it. Find the boo-boo. Fix the boo-boo.
Yes. So internal medicine wasn't my thing because it was a lot of chronic diseases that have no cure and more management.
Yeah.
And then general practice, it's great to see puppies and kittens every day, but vaccines and spay neuters kind of got boring.
Sure. Absolutely.
So I'm much more of the high-paced energy of the emergency hospital, never knowing what I'm going to do for that day, and actually being able to fix something.
So what brought you to Eve? So you founded Eve, right? You're a co-founder?
Yes.
Is that my understanding?
Yes.
Okay.
So Dr. Shannon Kafer and I met while we were both working as associates here in Arizona. and we worked for other people.
Sure.
And we realized that there was a lot of corporatization of our industry. So back in the day, when we grew up, there was the mom and pop vet shops.
Right.
And the owners were actually the doctors, your 1 or 2 doctor practice.
Yeah.
And everything came down to what your pet needed.
Right.
Nowadays, with a lot of corporatization of the industry, we've got quotas and incentives to try to sell people on medical treatments. And that wasn't what I wanted to do.
Okay.
Dr. Kafer and I met, and we had the same goals and ideas.
Uh-huh.
And we decided that we didn't want to work for corporate board members anymore.
Okay.
That were literally zooming it in.
Yeah. Okay.
Never
Good.
setting
Well played there.
never setting foot in the hospital, having no idea how the flow of the hospital went, or never touching a patient, and yet determining medical protocols.
Okay.
So we decided that we wanted to open an emergency hospital that would work like your family vet practice, where we, the doctors, are the owners.
Okay.
We set the medical protocols. There are no incentives to try to sell you on any medical procedures or medications. And then anything we recommend is based on your pet's medical needs from the person who actually touched your pet.
Right. So let's start to deep dive a little bit on Eve, right?
Okay.
And let's start with the distinction of you touched on it, the distinction between Eve as an emergency pet hospital and your neighborhood veterinarian. So what is Eve's place in that industry or that community?
So we are the stepping stone between your regular family vet that you go to for your normal checkups, your vaccines. We don't do vaccines, we don't do spays and neuters, but we can do small urgent care cases that sometimes your regular vet can do, like ear infections or broken toenails, but your regular vet is all full of appointments that day, or they're not open on the weekend. So Eve can supplement that kind of urgent care, as well as we can handle those big ticket emergency items, such as your dog got hit by a car or, bit by a rattlesnake. Yeah. That's not something that your typical everyday vet is going to handle, but you don't necessarily need a specialist all the time.
Sure.
We have several big specialty centers here in the Phoenix area where they've got board-certified surgeons and internal medicine specialists. But you don't always need that, and you definitely don't need the big price tag that comes with that.
Yeah, I got you.
So Eve finds our place in the middle ground. Where we can definitely help you with those bigger emergencies, anything up to a blood transfusion. We're not board-certified orthopedic surgeons, but we do abdominal surgeries, like foreign body removals. We even do GDVs or bloats.
Our puppy ate the little plastic thing and now it's stuck in the system.
Exactly like that. That's not something that every normal general practice vet would do. Or they can do it, but they've got a day full of appointments. And they can't set aside the time to do the surgery on your pet.
So you guys are, I think you implied this, you're open 7 days a week?
7 days a week, 24/7, 365.
Yeah. So talk to me, there are two of you as the primary physicians and the owners. Talk a little bit about your staff, because, staff makes things roll, right?
Yeah, so...
Do a shout out to some people.
Well, we've got Dr. Kafer is my business partner and co-medical director. She works primarily days. I work primarily nights. But we also have a few other associate doctors. Dr. Dagnall is another overnight doctor so that I don't have to work 7 days a week.
Fair.
Dr. Mitchell is another daytime doctor. We have Elena Gula is our awesome hospital manager.
Okay.
Erica Lamson is our veterinary technician manager. And they kind of run things so that I don't have to be involved in every single conversation.
Makes sense. Makes sense. So, by the way, you're doing a fantastic job. I have totally, just so you guys at home know, I've totally deviated from the questions that she gave me. So she's doing a fantastic job rolling with me on this. But let's actually get some details to people about where you are. So where is Eve?
So Eve is located on the southwest corner of Gilbert and Broadway.
Okay.
We're about a mile south of the Gilbert exit from the 60.
And how do people get a hold of you? Like, what's the phone number and the website?
So our phone number is 480-919-VETS.
Oh, well done. Well done.
So we are also on Facebook, on Instagram. We also have a TikTok.
Oh,
so
TikTok. All right.
If you type in Eve Pet Hospital, EVE,
Yeah.
you will find us.
Okay. So let's talk about patients a little bit. Let's talk about some fun patients. So obviously, given Eve's focus, right, you're seeing them usually in an emergency situation. Something's happening. Something's got to be fixed, right?
So either your pet is sick or injured, usually.
Okay. Tell us some stories about some of the cute, fun pets that you've had visit you.
Well, I recently had a patient come in for eating a foreign body.
Okay.
And they weren't sure what it was.
Okay.
But it wasn't actually showing up on the x-rays too well.
Okay.
But we could tell on the x-rays that there was something in there.
Okay.
And when we go into surgery, I actually found a binky, a pacifier.
Interesting.
But turns out this patient lives with a 5-month-old child.
Okay.
And
decided it wanted the binky.
It stole the binky from the child.
I've got to have that binky. That's my binky.
Yeah.
So that it's funny because I had a West Highland Terrier for a lot of years, and he had a foreign item that he decided was much better in his tummy than it was out in the world, and that is not how that works. So we had to similar type of thing, right? We had to go in and have it removed. So from a personal level, I totally understand that you guys provide a fantastic service because he was able to recover from that and carry forward from that, and it was just a nice thing. So on behalf of the people that did that, thank you for what you do. But tell us the scope of animals that you work on, like the scope of patients.
So we primarily deal with dogs and cats.
Okay.
I have seen a turtle for nasal discharge. I've seen a rabbit for eye discharge.
Okay.
But those are not our typical patients, and our technician staff are not equipped necessarily to handle the exotics. There are a couple of exotics vets. And we can treat them on like an urgent care basis, but not really hospitalize them. They take some specialized care that we can't necessarily provide. So we deal primarily with your dogs and cats. Anything from neonates, my dog just had puppies and one of them's not doing well, up to we had an 18-year-old Yorkie in the hospital the other day.
Wow.
Yeah.
So, I mean, talk a little bit about that, because this is tough work, right? Emotionally tough work.
It can be, yes.
Right? And a lot of times you're that person that family's got to deal with. So that's got to be, talk about that a minute. That's got to be hard.
So it can be difficult to play psychologist.
Yeah,
and that was not what I was trained to do. And unfortunately, we do have a lot of end-of-life discussions in my field because we are dealing with the sick and the injured. That there has to be that conversation. Can we do more harm than good by moving forward with medical treatment, or are we prolonging suffering? And that is a conversation that I do have to have sometimes with owners, that all the money in the world we could spend, we could have the pet in hospital for days and days, but is he going to have a good quality of life when he leaves the hospital?
And you really want to have that conversation with somebody that's empathetic to what's happening as opposed to too clinical, right? I mean, the answer might be the same, but you kind of want to know that that person understands what you're going through, right?
Absolutely. And I don't have anyone that works for me that doesn't have pets of their own.
Yeah.
So we are all pet parents, and we've all been there and had a sick or injured pet. And I think very few of us haven't gone through an end-of-life choice for our pet yet. So we can all put ourselves in the owner's shoes and empathize in a very personal way.
So let's come out of that.
Okay, yeah. That's a little heavy.
That gets heavy,
morning.
right? It gets really heavy. But my point in going there was to help people understand that you are the person that they can trust to have that conversation with, because you do know and you do care. So everybody take that part out of this heavy part of this conversation, because that's an important element for a pet owner, right? To know that they're trusting the person that they're working with.
Absolutely, and you can definitely trust the employees at Eve. They were all handpicked by Dr. Kafer and myself for their compassion and their work ethic, and not necessarily for their hair color, their tattoos,
right,
their pronouns.
Right.
We are a designated safe space, LGBTQ friendly, and all of our employees feel safe in our environment, and we invite owners to feel safe as well and talk about whatever you need to talk about to get through that kind of conversation. But we feel very strongly that the people who are talking to you about these medical decisions are the people who put hands on your pet.
Right.
Even though I'm the medical director, I work shifts where I work the floor, and I am in the room with the owners and their pets,
right,
examining your pet in front of you. So you know that anything I recommend for your pet is because I want that for your pet's medical needs, not because I'm trying to meet a quota that a corporation has set or incentivize you to buy this thing so that I get a kickback.
Right. So let's pivot a little bit. Let's talk about community stuff. Right?
Okay.
So you guys, obviously we had you on Mesa Morning Live last month. Talk about some of the other community things that you do.
We are going to be at the Los Sendes car show on, I believe it's March 28th.
It's funny because I just saw that yesterday and I was like, man, we should probably be there.
We're going to be there handing out swag. Come by, talk to us about your pets.
Okay.
We love to see pet pictures.
Oh, yes. Yes.
I would rather see your puppy on your phone than your child. Show me your kitten pics.
Give me the kitten pics. Give me the puppy pics.
Show me your kitties.
So what was in your time, not necessarily with Eve, but just in your time, we talked about owls, right? Mm-hmm. So kind of the exotic pet area. Talk about some of your favorite animals that you've interacted with.
So I did a lot of exotic animals when I was working through vet school. We had a zoo that was connected to our veterinary school. And so I got to do anesthesia on an Amur leopard.
Really?
Yeah.
Oh, that's cool.
Worked with a lot of the animals at the zoo, from the wallabies to the flamingos. But here at Eve, we actually had a crocodile come in.
Really?
I have a friend that works at the Phoenix Herpetologic Society.
Okay.
And one of their crocodiles, they were getting routine x-rays and noticed it had a nail in its stomach.
Wow. Oh, okay.
So we have an endoscope, which is the machine that you can go down with a camera down the throat.
Sure.
And they were able to bring the crocodile to our facility.
Get past all the little pointy things
and anesthetized him and actually retrieved the nail endoscopically.
Nice.
Without having to cut him open for surgery.
Right. Oh, that's fantastic. Okay, so what would you tell people, like, what's the best thing they can do to keep their pet from coming to see you?
Have a primary care veterinarian.
Okay.
So we are not there to replace your primary care veterinarian.
Right.
We are there to supplement the care of your primary care veterinarian. So it's still very important to get your pet vaccinated, to get your pet spayed. if you get your pet vaccinated against parvo, you're not going to come to me and have to be hospitalized when your pet gets sick with parvo.
Cool. Okay.
If you spay your dog when they're, before 1 year of age, you're not going to have to come to me with a pyometra or an infected uterus when they're 9 years old and maybe not the healthiest thing to put under anesthesia.
Okay.
Keep your dog on a leash. That is very important. Number one cause of dog bite wounds is that dogs are not on a leash.
Really? Oh.
Just because your dog is friendly doesn't mean other dogs are friendly.
It's like driving. Just because you think you can drive doesn't mean the other guy can drive.
Exactly.
So, okay. So do you keep a referral list? So if people are looking for a primary veterinarian, do you keep a referral list for that?
Yes,
Can they call you for advice on that?
I would love to shout out to my very good friend, Dr. Heather Perry and Dr. Hector McFarker, who own Alma School Animal Hospital.
And we'll be joining the chamber now very quickly.
They just bought Alma School a couple years before I opened Eve. But Dr. Perry and I worked together in our internship. So we trained together. I know her. I know she can handle it.
Yeah.
And she runs a general practice, and I run an emergency practice.
Okay.
So she refers to me, and I refer to her for any general practice needs. You need to follow up after your dog bite wound, or you need to follow up and get the vaccines. That's who I mainly refer to. But we have several other vets in the area that we've become close partners with. Curum is a great referral source for us. They've sent us a lot of pets, things that need to be hospitalized overnight when they're not open overnight. Family Vet Care of Mesa, Exceptional Pets of Mesa. So if you come to me and you don't have a primary care veterinarian, I can definitely point you in the right direction.
Cool. Very good. So, okay. So talk about, let's get back to Eve for just a second. So how long have you been open?
So we just opened June 1st of 2024. So
right.
we have not even been open a year yet.
And so how are things, I don't want to say how's business, but are you finding that the business model is validated? Are you finding that people are coming to you as opposed to the large organizational?
Yeah, I've actually been rewarded with some repeat clients already. Not great for the pet.
Yeah.
But there are families that have come to us because we did a great job handling their pet before, whatever XYZ that their pet had before. They come back to us for rechecks, but also the next time their pet got injured or something, they come back. And we've noticed that our referral base has grown. People like the employees at Curum, employees at Family Vet Care of Mesa are referring to us now, where we're trying to get our name out there, and definitely slow start.
Well, it's been less than a year. Come on now.
Yeah.
Give yourself some time.
Of course. So, just word of mouth. People are saying that, a friend of a friend, my neighbor, brought their dog to you, and when this happened, this is who they recommended. Okay. So we are finding that our business model is showing returns already, and we're not even at a year.
Nice. So let's wrap with a couple of pieces of advice. Obviously, most people have cats or dogs. So talk about a couple of red flags that pet owners, if they see them, should consider either giving you a call or getting an appointment on that primary care physician, schedule. Just a couple of things, because we don't always. I think at one point our vet had told us, animals are very good at hiding their wounds, right?
They're stoic.
So, what are a couple of things that you might see in a dog or you might see in a cat that might give you reason to be like, we better get this looked at?
So most important for a cat, I think, is particularly male cats. If you find that your pet is going in and out of the litter box, straining to urinate, or looks like he's straining to defecate, urinary obstruction, so when they can't pee, can be fatal within 24 hours.
Oh, wow. Okay.
That is not something you want to wait on. You don't want to wait until next Tuesday. I've got an appointment with my general practice.
Sure.
If your male cat looks like he's struggling to pee, come in immediately.
Okay.
As for dogs, for the big dogs, things like your German Shepherds, your Great Danes, some of your bigger Labradors, if they ever have a bloated or swollen abdomen and they look like they're trying to vomit, but they're not actually vomiting.
Okay.
Some people think, well, he's nauseous, but he's not actually vomiting, so he's probably fine. Wrong. If a large breed dog ever has a swollen abdomen and they look like they're trying to vomit but can't, that could be bloat or GDV, gastric dilatation and volvulus. That's where the stomach turns over and it actually cuts off the blood supply.
Oh.
And that is also something that could be fatal within 24 hours. And you need emergency surgery to fix. That is the only way to fix it. So something like that, some owners don't know, and they should definitely keep an eye if you have a German Shepherd or a Great Dane or a large breed like that.
And I'm assuming that you guys are always available for phone questions.
We are absolutely available. Again, our phone number is 480-919-VETS or 8387. When we answer our phone 24 hours a day. And we will be honest with you if we think that your pet is normal and we can explain something over the phone, we will. I just had a conversation last night with an owner that called after her dog had vaccines. And he was acting very lethargic. And she thought that he felt warm, like he might have a fever.
Okay.
So I instructed her, I was like, can you take his temperature? And if it's below 104, he's probably fine. It's very normal to be slightly lethargic.
After you get a vaccine.
After you get a vaccine. We've all had those kind of days after the COVID vaccine or the flu vaccine where we feel it.
Right. Yep. Yeah.
And pets are the same. But if your pet is having hives or is vomiting after a vaccine, that's something that we're going to tell you to come in for.
Cool. All right. Well, thank you very much for taking the time to come and visit with us today. One more time, give out that website address, give out that phone number, give out that physical address, just so people.
So we are evepethospital.com, EVEPET hospital. And our phone number is 480-919-VETS or 8387.
She does this little thing where when she says, she's like, VETS. It's very cute.
I'm very glad that we got a catchy phone number.
Is there anything that we didn't talk about that you want to talk about? Let me kind of give you a minute here because I know we deviated completely from the script that you sent me. So I'll give you a chance
that was not on the script.
Yeah, sorry about that.
So our building, we are located on the southwest corner of Broadway and Gilbert. We are a standalone building. We're nearly 7,000 square feet.
So good sized facility.
Good sized facility. We've got over 40 kennel spaces.
Okay.
We've got 4 oxygen cages. We have a surgery suite. We have in-house radiology, in-house blood machines. We have not only the oxygen therapy if your pet needs.
So that means fast testing, right? That means like
that means
you're going to get info quickly.
You do not have to wait for me to send out the blood work and call you tomorrow. Right. You will get results within 2 hours if we do blood work.
That's important, right? If we're doing emergencies,
very important in emergency setting that you will get answers. We do in-house x-rays. I do send them out to a board-certified radiologist to read, but you will get a board-certified radiologist reading your x-rays within 2 hours if we take x-rays at Eve.
Yeah.
So it is very important for our emergency service that we are able to quickly diagnose whatever is going on with your pet. And we have the facilities and the staff to maintain 24/7 care of your pet. Your pet will never be alone and on IV fluids. We check. Most pets get checked on every 4 hours at a minimum.
Okay, cool. So, Dr. Kaleigh Robinson, thank you so much for being a part of today's podcast. It was all about you.
Well, I do like talking about Eve. It is definitely my passion that I've found
It really is a fantastic facility. Like, it really is. I mean, and if people just kind of want to come check it out, like, they don't necessarily have a reason.
If you would like to tour, absolutely come on down.
Right?
We may not be able to facilitate it right that second.
Yeah.
There, in an emergency.
Maybe a call first.
Call ahead. If we're not busy, we are happy to give tours. But sometimes there's an emergency happening.
Yeah.
Probably can't walk you to the back if I'm doing CPR. But if you would like to come
If things are happening, it might be a minute.
If you would like to come tour the facility, we are open for tours.
Okay.
Just call us at 480-919-VETS. And we are happy to talk about, even if you can't come in, we can talk about something that you're concerned about with your pet. Tell you if you need to come in, if you can wait until morning to see your regular vet.
Sure.
And we're happy to be here and be a service to the pet owners of Mesa.
Well, thank you again for being here. This has been the Inside Business, Mesa Chamber of Commerce Inside Business Podcast. I am your host, Bob Nelson. And we will see all of you, including Dr. Robinson, soon. Bye.
Bye.
This has been a Mesa Chamber of Commerce Inside Business Podcast. You can find all podcast episodes at iTunes, Spotify, or your own favorite podcast website. You can also find them online at mesachamber.org. Content of this podcast is copyright the Mesa Chamber of Commerce, unless otherwise noted.